Hello everybody, welcome to the next lecture in our aesthetic series. Today we will be talking about the most common aesthetic procedure, microneedling. What is microneedling? Sometimes it's called collagen induction therapy or percutaneous collagen induction. It's a minimally invasive cosmetic procedure using fine needles to create controlled microscopic injuries in the skin. This will stimulate wound healing without causing significant damage to the epidermis. This increases your collagen production, increases elastin, improves skin texture, reduces scars and wrinkles, and improves skin firmness via remodeling. Why do people do this? Well, because skin ages. So why does skin age? We have two main categories of aging, intrinsic and extrinsic. Extrinsic factors are things like smoking, pollution, poor diet, chronic inflammation, and radiation, sunlight especially. Intrinsic aging are things you can't really control, such as your genetics, general collagen synthesis that reduces as you get older, fibroblast senescence, and hormonal changes. This results in less collagen, less elastin, more wrinkles, having thinner skin, larger pores, and hypo and hyperpigmentation. So before we get into microneedling, we need to understand the anatomy of the skin. Our outer layer is our epidermis. It's your protective barrier. It has keratinocytes and melanocytes. Then just below that is our dermis, which contains our collagen, elastin, blood vessels, and our fibroblasts. And then below that is our fat, what's called our hypodermis. Microneedling typically targets the dermis while preserving as much of the epidermis as possible. So in essence, we get thousands of tiny microchannels, which leads to an inflammatory response, which causes growth factors to get released, fibroblasts get activated, collagen gets made, remodeling occurs, and stronger, healthier skin results. So then we get to the wound healing cascade. We have phase 1, inflammation lasts hours to days. So normally you will be a bit red for a while after a procedure. You get platelet activation, cytokine release, and growth factor release. Then phase 2 is proliferation, which lasts days to weeks. Fibroblasts come to the site of injury. Angiogenesis, i.e. new blood vessel growth occurs, and you get new collagen deposition. In phase 3 is your remodeling phase, which takes weeks to months. Collagen fully matures, elastin settles in, and you get a stronger dermis overall. So our main growth factors are platelet-derived growth factor, transforming growth factor beta, vascular endothelial growth factor, fibroblast growth factor, and epidermal growth factor, with all of their uses there on the right-hand side. These essentially just stimulate new blood vessels, collagen deposition, elastin formation, and fibroblast proliferation. So how? You get a dermal roller, which is the top right corner. It's fixed needles, can be done at home, and it is affordable. You essentially just roll it over the area. Then you get a derma pen, which is motorized, has adjustable depth, is less dramatic but needs training. And then radiofrequency microneedling, which is a combination of needles and heat, which is more beneficial for acne scars and for better skin tightening. So you have different needle depths for different applications. 0.25 millimeters is good for product penetration, such as your collagen serums, vitamin C serums, astaxanthin serums, yada yada yada. 0.5 millimeters for 5 lines and pigmentation. 1 millimeter deep for collagen stimulation. 1.5 meters deep for acne scars. And then deep scars in non-facial areas need to go about 2 millimeters deep. Evidence for microneedling is in support of treating acne scars, surgical scars, photoaging, wrinkles, enlarged pores, stretch marks, melasma, but select cases, for alopecia and skin laxity. Topicals typically used are vitamin C, hyaluronic acid, growth factors, exosomes, but those still have emerging evidence, platelet-rich plasma, PRP, which comes from your own blood, tranexamic acid, and minoxidil. The minoxidil is for your scalp, for hair growth. Your contraindications to microneedling are bleeding disorders, people on anticoagulation, people with a tendency to form keloids, um, isotretinoin use, i.e. Accutane, active acne infection, herpes simplex outbreak, because you're just going to make it worse, cellulitis, open wounds, skin cancer. Do not microneedle skin cancer, please. Poor wound healing and uncontrolled diabetes, because poor wound healing. So for the practitioner, always use sterile needles, do skin antisepsis techniques, and use proper technique. Gloves, a good quality skin cleaner, and not reusing needles. Avoid reusing them. Home devices, do not use with too deep penetration. And then do not use non-sterile products immediately post-treatment. Sourcing is important to avoid contaminated products as well as products with poor ingredient quality. So for the treatment, there's some prep beforehand. Avoid retinoids and excess sun exposure for a few days. Avoid recent chemical peels because it is still busy healing. And consider antiviral prophylaxis in patients known with herpes. Then aftercare for the first 24 to 48 hours. Avoid makeup, avoid excess sweating, avoid swimming and saunas, i.e. moisture. Avoid direct sun exposure, and daily use a gentle cleanser, a moisturizer, and an SPF 50 or greater sunscreen. The treatment is typically 3 to 6 sessions with 4 to 6 weeks between sessions. That turns out take about a year to do a full course, basically. Collagen remodeling continues up to 12 months post-treatment. What's great for microneedling is that it's suitable on darker skin types. There's minimal downtime, like 2-3 days. It's cost effective, repeatable, and there's multiple uses and indications. Yeah, that's basically microneedling in a nutshell. Thank you very much for listening. We will see you in the next one.